Good morning, we're back, Senate Health and Welfare, and we're gonna move on to two bills that we've been working on that are currently on the calendar, returned from the House. So the first one we'll look at is S-189. Katie, can you, go ahead?
Sure. Good morning, Katie McDonald, Legislative Council. Here is S-189, to refresh your memory. This was a bill that had sort of multiple pieces in it as you continue to work on it. So there was a section on mental health guidelines for crisis response situations. There was a section on social workers convening a meeting to talk about safety. There was a section on home health agencies having the ability to deny service to a person when their service was previously terminated due to a safety risk. So there are not a whole lot of changes to the language that you worked on. What has changed is in the home health agency section. There's a new subsection B and C I'll walk you through. There's also a new section 4 that asks for a report back to collect more data on home health agency discharges for safety. So those are the two major changes. And then we have some parties added to the social worker. So first is the mental health response guidelines. This directed the department to develop guidelines for use by municipalities. Where am I? The guidelines shall recommend best practices for de-escalation and for mental health response services, including crisis response services, and the department shall make the guidelines available to municipalities and publish guidelines on the department's website. That's all language you sent over. And then we have the groups that the department shall consult with. And the addition here is subdivision 10, the department state program standing committees. So that's what's been added there.
Sorry, how many committees are there? Standing committees?
There is a for the Department of Mental Health, there are two. There's an adult standing committee and a youth standing committee.
Great, thank
you.
Okay,
Okay,
I totally didn't listen to that. Can you go back?
I pretty much said I didn't make many changes.
No, I know, I got it, okay, it's fine, who was added to the?
The Department State Program Standing Committees. And there are two
Okay,
standing
got it,
committees.
okay, got it, thank you.
Section 2 is a presentation on social worker, social service provider safety. So you remember that this was directing AHS in collaboration with the Vermont chapter of the National Association for Social Workers to convene one or more meetings related to social worker provider safety. And then there's a list of the community-based social service organizations and professions to be included. Added to this list was subdivision H, any other stakeholder deemed appropriate by the agency. I'm trying to remember specifics, but they also chose to use the word stakeholder instead of, I think, interested party. So that was a change. And subdivision 2, you had language that in advance of the meeting, participants could review relevant studies and individual experiences with regard to social worker safety. There is a word change here to make it clear. I think on line 7, it was may review both studies, meaning the studies and the social worker provider safety experiences. That was confusing because it suggested there were 2 studies that people were looking at. So that word was instead changed to relevant studies. And subdivision 2, I don't believe has changed. I'm sorry, subsection B hasn't changed. And this is that AHS in collaboration with the Vermont chapter of the social worker group is to come back and present findings.
Okay.
And then we have section 3, which is the home health agency section. So I believe subsection A has remained the same. And that is that if an individual was previously discharged from safety by a home health agency to protect the safety of staff in accordance with the rules adopted by Dale pursuant to a section of this chapter, and the behavior or conditions causing the discharge cannot be reasonably mitigated or eliminated, a home health agency may deny a subsequent admission or decline to send a home health agency employee to make a visit if the home health agency has reason to believe that the individual who exhibited the behavior that resulted in the discharge is present in the home. And then the two new subsections that the House is adding. First, in subsection B, nothing in this section shall be construed to require a home health agency to enter a home to determine if a risk can be mitigated or eliminated. And then in subsection C, a home health agency shall provide notice of any denial of admission made pursuant to this section. There's a lot of conversation that this is already a requirement under their rules, but there was a request to put it in statute, so that was added here. The notice shall include the reason for the denial of admission and information regarding how an individual may submit a complaint pursuant to the chapter in accordance with the rules adopted by Dale.
Okay.
And then related to the home health agency discharges is this new reporting requirement. On or after February 15th of this coming year, in consultation, home health agencies and Dale, they're to provide updates to the various policy committees on the implementation of the section we just looked at. Specifically, the update shall address the number of safety discharges made by home health agencies during the previous calendar year, the nature of the risks posed that results a safety discharge, and third, the number of individuals denied subsequent admission to or services from a home health agency due to a previous safety discharge. That is it. They kept your effective date.
Okay. Questions? Are we okay with this then? Committee?
Yeah.
Any more, any concerns?
It's reasonable.
I think we can concur with the House if that would be
Yeah.
choice.
Okay, sounds good.
I'll just do that. I'll do it today and get it off the calendar. And then S25 is the other one that we have that's a little more difficult to resolve.
Would you like me to push document?
Yeah,
Okay.
and I'm gonna say that I'm gonna have to go report something down to agriculture to give a little report, but I'll get started with this and then I'll leave.
Okay.
And I'll leave.
Before fools.
Good.
Assume
I
power.
wanna be, I'm leaving you in the clerk's hands.
Benevolent dictator.
It'd be good. Okay, so no, 189 is good. We're fine with it and we'll look forward to having it on the calendar. Thank you all for your work.
Thank you. Thanks. Are we moving to 25? Is that what I heard?
I think so. Yesterday, we talked about having a side by side with just the effective dates. Would you like to look at that or would you like to start somewhere else?
Yeah. Let's start with that one.
Okay, great. This is kind of sultry, look.
I'm still sending out to the.
You're on.
I am? Oh, I did, you're right.
Yeah, thank you.
I'm not, yeah. I can tell you why later.
All right,
Okay.
here we are.
Here we are, S25. So we sort of had an overview of the Senate, of the House's proposal yesterday. We talked a little bit about the differences. One of the questions that kept coming up was what are the differences between the House and Senate effective dates? So in the House version of the bill, with regard to cosmetic and menstrual products, they break it down into two different timelines. There are additional chemicals on the second date that are added. And there's the language about lead, 10 ppm, that's added on the second date. There aren't tiered effective dates for that in the Senate proposal, so your effective date was January 1 of 25. Remember when you're looking at the Senate dates that you worked on S25 last year, not this year. Next, so some of this isn't totally apples to apples, but you're moving much of the language on PFAS from 18 to Title 9, and you're adding in some new types of consumer products. So that move and the addition of those products in the House version takes effect January 1, 26, and in the Senate version, where there's only textiles added, not the cookware, incontinency products, juvenile products. That is, January 125. And then both bills do the tiering for the definition of, textiles, adding that outdoor, severe wet conditions, for the outdoor apparel. And then, changing the definition of regulated PFAS. So those are apples to apples comparison, and it was funny to put this together because you're exact opposite, of that house on this. So on the definition, they're July 127, you're July 128. And then on the definition of regulated PFAS, they're July 128 and you're July 127. Consumer products, the turf, the artificial turf. Your effective date was July 1, 23rd, and theirs is January 1, 2028.
That's a big difference.
Yeah.
That one, the others are not as problematic. That one,
Sorry.
yeah.
And then, there were two reports. So the community engagement report, we talked about how they look a little bit different, they're not completely identical, but, the effective date for the House version was, July 124 of this year, but the report itself is due July 125. And then your, bill had taken effect July 123 with that information coming December 1, 2024.
That's okay.
Mhm.
I guess. So we won't have a quorum if I leave, so I'm not leaving, yet, but the turf. What do you guys think about the dates up there?
Can someone explain what their rationale was to up it so far?
I can talk a little bit about the conversation. They were feeling that, the other products they were adding, the juvenile products, cookware, for example, had already been adopted in another state. And so, they were feeling more comfortable having an earlier implementation date on those, and, the conversation upstairs had been that Vermont would be the first to have a lawn of artificial turf, which we heard yesterday. Was it Maine adopted?
Yeah, they
in the
made us.
interim? So Vermont is no longer the first, but that was sort of the
Would have been.
conversation that because other states hadn't taken that action yet, that they were going to give a longer.
We had a long conversation about the timing on that, and so what would we put it to, July 1st, 2024? Or
Oh,
a little
that's-
bit later?
The rest, I mean, you can pick whatever date you want and I can work with that. The rest of the chapter that it would be going into doesn't exist until January 1, 2026. So the turf is amending this chapter and adding it into this chapter.
2 years.
I definitely think 28 is too far in advance. I mean,
Totally.
in part because the people who are most likely to have their face in the turf are kids and young adults. And so that's concerning to me. Yeah,
Given the current financial situation of our schools, do we even foresee that anyone's gonna be putting in artificial turf in the next 2 years?
well, my understanding is this applies more broadly. It would apply to like higher education and just in general, anybody who might be considering putting in a turf.
Who else would be putting turf, though, other than maybe a college?
A town, at the
fake
at a rec
grass
center
matter.
or the town, or a private college, there are, other entities, a private recreational center.
Okay, well, they're not, they're just, I know from experience, they're not cheap, so.
They're not cheap,
Given
but,
that we seem to be broke as a state, I just wonder.
well, I happen to live in a town that has an institution that has enough money to buy artificial turf, and I'd kind of like it not have PFAS in it.
I'm going to, so
Do they
what would happen if,
But
what would happen if we had the date 25? Yeah, what would that
Um,
do to your chapter?
I
Would it
mean-
disrupt the world?
Whatever you decide to do, I can make it work.
Yeah.
It would probably mean I would have to go in piecemeal
26.
I think we do 26. I think it's fine. That's
If we do
the
26.
years. It creates less havoc for Katie's world and,
We don't want her.
it's a good compromise between what we had and what they have.
26.
26.
Yeah, but
January 1, 26. That's an easy change to make. Often when we do these like final proposals going back, we do instances of amendment. In this case, I might just do a strike all and indicate to the House Human Services when they look at it what has been changed. Because it might be easier to just see this section inserted into the chapter they've already created.
okay.
Are we?
We're not
might have-
finished with
Yeah, we
this.
might have a couple other.
We have
changes.
other things that we need to look at. Maybe you could help us. I know the lead thing is a big deal. And what are the other places, Katie, that we,
We have talked about enforcement.
yes, let's do that. That's one we can talk about
Okay.
pretty.
I don't have my notes.
And I'm gonna give myself 2 more minutes and then I'm gonna go to agriculture and, well,
Are you able to say this one?
I can,
all right, good.
We need
And the clerk is gonna clerk.
I will personal application. She's the
I
director.
apologize,
My God.
but I couldn't. Sure.
I mean, unless you want to. No, I want you to have control of our team, like
I
literally.
eat my salad.
Okay,
Okay, so the language we talked about, yes, the conversation we had yesterday is that this bill doesn't specifically have enforcement language in it. Many of the subchapters in Title 9 of this chapter do have language about violations, and I have the language that some of those subchapters have. So that language is that a violation of the subchapter is deemed to be a violation of section 2453 of the title, and that the AG has the same authority to make rules, conduct civil investigations, enter into assurances of discontinuance, and bring civil actions. And private parties have the same rights and remedies as provided under subchapter 1 of this chapter. So the question is, 1, would you like language like this? And if so, would it look like this? Is this the language you want to see? And if the answer is yes, then I will start embedding it into each of the new subchapters that are being created in Title 9.
Is it an easy thing to pull it up?
Oh, yeah.
If it's hard.
oh, that's a good idea.
The House bill, what would you like me to pull up?
The
One you just read.
Yeah.
Oh, that, yeah.
I need the visual.
Yeah, so I'll just be pulling it up from existing law.
And this is consistent with other things we've done.
Yeah, we looked yesterday at what we currently have for like firefighting foam, for example. Or was it firefighting foam? Maybe it was rugs and carpets. And this is the language
Yeah.
that was used, but it didn't carry over. Okay, consumer protection.
Do we have people scheduled on 25?
The AG and
On Wednesday, we have this scheduled again. Okay, here we go.
So this is pulling up a subchapter, within the chapter where these subchapters would be added. So this particular subchapter, which is, specific to letting consumer products, has the language that I just read.
So we would be referencing it for all the consumer products that we're talking about.
You would be adding identical sections
Yeah.
into each of your subchapters.
Okay. All right,
Sounds good.
I'm good with that. Okay,
I'll put that together.
please.
Thank you.
All right, I'm gonna leave you, you can have a conversation about lead. And because we're gonna come back to this next Wednesday, just to let you know. And
And we'll have some people that talk to us and educate
we've
us
got the
on.
AG, who else we have coming in? Matt Chapman,
Excellent.
AG. And then we've got our Marcy and Bill are here, and that's good to have you in the room as well. get to a conversation.
We'll try to use the same seats. So
Yeah, we'll
there's
have-
no confusion.
There'll be more. But it will be important for us to, have that little bit of a dialogue.
And Marcy, are you gonna do the like chart thing?
I am sending it to you right now.
Oh,
Good. Kiki, did you send it? Kiki?
Yes.
Yeah, good, okay.
I'm-
thanks, Katie.
I'll that.
You promise?
I don't know what they'll do to me in that.
She may never get that. Agriculture.
Hopefully you won't get stung.
I know.
Killing them all.
All right, what are we doing, Madam Chair?
Oh, we are going to talk about lead. And we just got sent did it go to Kiki or did it go to?
I'm sending it to all of you and
Okay, great.
just, yes.
And, would you like to go through it with us?
Sure.
Wonderful.
Send it by email.
Yes, I just sent you the email. So, for the record, Marcy Gallagher, Farms Advocate with Beeford. I included a disclaimer on this email, which is that I am not a lawyer or an expert, so this is the result of some research, but I'm sure the Department of Health would have the most accurate and up-to-date information, but I did the best I could to make sure this is all up to date, so.
I didn't get it.
You haven't gotten it yet?
TK.
Yeah, I think sometimes it has to go through some barriers.
Okay.
Yeah.
There's two carry away.
I just got it.
You're TK.
I'm TK.
Yeah.
I just got it.
That's
Oh, okay.
Checked. Yeah.
Yeah, yours, got it.
Okay, great. So I started with drinking water in schools, which, as I already noted yesterday, that's at 4 parts per billion, which is significantly smaller than 5 parts per million.
Point well taken.
And was talking with Paul about this. We're pretty sure that this was and probably still is the strongest restriction in the country on lead in school drinking water. Then we have children's products. This is regulated at 100 parts per million in certain children's products. That was of January 2010, and I couldn't find anything more recent about whether that's gone down or not. But it started, I think, at 500 and went down to 100, started in 2010. Then I found some information about disclosure, which I think was relevant to the conversation yesterday. So there are requirements for disclosure on lead for certain products. And California does list lead in Prop 65. So would imagine it's labeled on those products. And then non-children's jewelry, pictures, and non-residential things and timers are all supposed to be labeled in Vermont. Although I don't know if that's actually happening. Lead testing in Vermont, this was really interesting to me. So we now do lead testing every year. In 2022, lead was detected in over 1,500 Vermont kids under the age of 6.
Marcy, do you want to pull this up?
Yeah, if you could send me the link, then I will
That'd be great.
share my screen. So Vermont was the first state to define a blood level, and I don't even know how to pronounce this, but I think it's like 5 milligrams decimal or something, but
What
this is
page?
the top of page 2.
Okay. Yeah, I wanna go over those measurements with Matt Chapman next week, cause I'm also confused by them, and the EU measures things differently, and so I'm really curious about.
Yeah, and the will be much better. But we actually don't use that measurement anymore. We now say any amount of blood detection is not safe and therefore requires testing and working with a doctor on it, because yeah, any level of blood can still impair development. And then there's also, so there's in the yearly reporting section, you'll see, and I didn't know this before, so this is really cool. There's every year
study about lead, and for the most recent one I could find, it showed that the social and economic benefits of lead hazard control had an estimated return of 17 to 221 for every dollar spent, because of things like lead hazard control, reduced healthcare costs, lifetime earnings, tax revenue, special education costs, behavioral disorders, and crime. And I'm gonna jump.
Do you know who did that study? Who does this study?
That was Mark Levine,
Oh, wow, great, okay.
and I'm gonna pop on Zoom.
Thank you so much.
So we are down here. So I recommend looking at this yearly report from 2023. It had a lot of really good information. It didn't have any kind of recommendation on cosmetics or what we're discussing here, but just for more context.
Yeah,
Yeah, then Vermont was one of the first states to restrict the amount of lead in fixtures. And there's a lot of information about lead abatement, but I thought that that might be what folks are already most familiar with, just when, working on houses that were built prior to 1978. There's lots of, regulations, particularly for, landlords and owners.
Terry, do you remember when you were talking about those lead pipes?
Yeah.
Do you remember what the percentage was? No, maybe that wasn't even documented.
That was 55 years ago.
Yeah.
54 years
Okay,
ago.
it was probably over 8% though.
Yeah,
I judge looking at this.
and for most of these things, I found that the federal standard was higher than Vermont's. Vermont was a bit more aggressive on almost all of these things, if not all of them. So that is what I found. Again, I don't have a ton of expertise on this, but I can try and answer any questions.
Oh, this is helpful.
Mm-hmm.
I'm surprised by that 100.
Yeah,
I wonder, we just have not gotten back to it. Apparently.
as far as I,
Yeah, I mean. Okay.
What was that?
Then the children's products.
I'll have to look.
Yeah.
I'll run upstairs right now.
Yeah, thanks, fine, we have to go to the floor.
Uh-huh.
Anyway.
Thanks, Marcy. It was really helpful.
We offline.
I